I would now like to introduce Bettina Drake. Professor Drake serves as professor for the Division of Public Health Sciences for the School of Medicine and associate director for community outreach and engagement for the Siteman Cancer Center. She will speak today about cancer and eliminating disparities and promoting prevention. Welcome, Professor Drake.
Thank you. I'm excited to talk today about some of the work that the School of Medicine and Siteman Cancer Center is doing to promote cancer prevention, expand clinical services in order to reduce disparities in our region and beyond. I want you to think about for a moment being an African-American female over the age of 40 with a family history of breast cancer. These are the most common non-modifiable risk factors for breast cancer. Also thinking about having to watch family members and friends go through the diagnosis, treatment, and the various outcomes that come with being diagnosed with breast cancer. What would be your number one priority? For many of us, it would be to make sure that we have an annual screening. But for many women who are uninsured, annual screening is not a viable option. So lack of insurance is it's just one of many social determinants that lead to increased cancer burden as well as high rates of cancer mortality within the nation. But we also have high rates of cancer mortality right here in St. Louis where we live. The star in the center is St. Louis. It sits right between Missouri and Illinois. And the orange line includes 82 counties that make up Siteman Cancer Center's catchment, where 87% of patients seen at Siteman Cancer Center reside. And within these counties, 38% of them are in the highest US quartile for cancer mortality. Not only do we have high rates of cancer mortality in our region, but there's also high rates of cancer disparities, both within the nation as well as within Siteman Cancer Center's catchment population. Between the nation and Siteman Cancer Center, we see the black-white mortality ratio is about 1.4. So African-American women are about 1.4 times more likely to die of breast cancer compared to white women. But also right here in our own backyard in St. Louis County, African-American women are 1.9 times more likely to die of breast cancer than white women. So why do we see these continued disparities throughout our region? We know that biology and genetics play an important role, but lifestyle factors are also important that give us ideas on how we can prevent the disease. And having insurance allows us to be able to access early detection so we can have regular screenings, as well as have access to recommended treatments after that. So within Siteman Cancer Center, the program for the elimination of cancer disparities was developed in 2003, over 15 years ago, with that goal as the premise, in order to promote cancer prevention, to eliminate disparities within our region, expand clinical services, but also to work with community partners in order to create this change. And over this time, we've really honed a Siteman Cancer Center comprehensive outreach strategy that includes cancer-specific community partnerships for our breast cancer groups, prostate and colorectal cancer, our clinical outreach services that we have for mammograms and for PSA screening, a host of culturally tailored and evidence-based educational materials, as well as a number of community organizations. We know from over a decade of cancer prevention and control research that up to 50% of cancers can be prevented by changes in health behaviors. Things like eating a healthy diet, exercise, maintaining a healthy weight, and the biggest one of all, smoking cessation. So Dr. Graham Colditz at Siteman Cancer Center developed these evidence-based, culturally tailored 8 ways to prevent cancer educational materials. And we use these materials, they've been targeted for breast cancer, colon cancer, even for cancer survivors. We've translated them into Spanish and other languages in response to community input. And so we use them throughout all of our community events, and we share them with our community partners. PCAD's signature event is our Smart Health Day, where we bring together community members in a community setting, invite physicians, researchers, academics, as well as survivors to tell their stories to promote educational information. But also important, we also provide access to clinical services. We bring them to the community. So we have free PSA screenings at the events, as well as we bring out Siteman Cancer Center's mobile mammography van. Now, the breast health outreach program at Siteman Cancer Center is one of the largest and most comprehensive of its kind in the state of Missouri. It provides no-cost mammograms for under and uninsured women who qualify. But a key component of the outreach program are our breast health navigators. A work group of the navigators was established in 2010, and they really help navigate women between the different health systems as they transition from screening to diagnosis and treatment. But also really important is that they connect women and help them navigate connecting to those financial resources that can help uninsured women receive the care that they need. So in addition to the education that we provide, as well as the clinical services, women still report several barriers to receiving annual screening. So we did a survey of about 9,000 women who received mammograms through the Breast Health Outreach Registry. And the top barriers that they reported were fear of cost, fear of mammogram pain, and fear of bad news. 40% of the women surveyed reported fear of cost as their #1 barrier to receiving annual mammograms. And 13% reported fear of mammogram pain and bad news. But back to fear of cost, it's not just associated with the cost of a screening mammogram, but what are those additional costs if future tests are required? Costs associated with the diagnosis, wages lost for having to take time off of work, and mounting medical bills if you have lack of insurance or you are underinsured. So it's important, in order to address these barriers, we like to connect the science to real people. And that's why at the heart of all of this are our community partnerships as well as our survivor voices. Our overall advisory group, the Disparities, Elimination Advisory Committee, as well as our cancer-specific partnerships, their membership is included from a variety of community organizations. And hearing from our survivor stories helps us to tailor our community outreach activities, but also it promotes trust and reduces fear and anxiety for community members more broadly. So an example of the implementation of our comprehensive outreach strategy, in 2010, we noted that among Siteman Cancer Center breast cancer patients, 24% of African American women were diagnosed at late-stage disease. 13% of white patients were diagnosed at late-stage disease. And this was a pretty significant racial disparity. And so all of these efforts were taken specifically focused on breast cancer outreach, the Navigator program that I mentioned, the Breast Cancer Community Partnership, integrating in our evidence-based materials in our community organizations. And in 2018, we saw that now a reduction of 14% of African American women were diagnosed with late-stage disease, a 40.5% reduction in late-stage breast cancer among African American women. And this is evidence that if we're going to reduce disparities, not just in breast cancer, but in prostate cancer, in colon cancer, in lung cancer, it's going to take a comprehensive strategy, and it's going to require us to work together, academics, clinicians, as well as community members. Thank you.